Okay, so hello and namaste, and I hope that all of you can hear me. I hope the audio is okay. I hope the video is okay. And welcome to the last session, the finale session of of the entire course, dermatology, that we had for the last few months. And I hope that the voice is okay. We are having this today on the Zoom, and it's also open on the YouTube today as the last session. We wanted to open it for a few more of our friends. So let's straight away start our talk. So as we talk today about homeopathy, and as we talk today about where we lie in homeopathy today, and you can see this a very interesting graphic representation of where we actually are in homeopathy. That all the foundation, all the basics that we know about homeopathy, all the ideas of the 153rd aphorism given by Master Hahnemann, a lot of structurizing about the repertory, about the modalities, about the concomitant symptoms given by Master Bonninghausen, also known as the father of repertory and the closest ally to Master Hahnemann. In fact, Hahnemann writes in his writing that if there is one person who I can give my case to when I'm sick, it would be Master Bonninghausen. So Master Bonninghausen was not just another homeopathic colleague for Samuel Hahnemann, but he was much more than that. Samuel Hahnemann saw Bonninghausen as someone who will take homeopathy to the next level. And this is where importance of understanding history and the legend behind every aspect of homeopathy is so important. And we can't talk about Bonninghausen and not talk about Boger, the great Boger, Cyrus Maxwell Boger. And he really was able to bring the ideas of Bonninghausen and Kent in the center. He was able to understand the ideas of generalities, concomitants, and also understand Master Kent and Kent's ideas of mind symptoms, of understanding the mental qualities, of understanding deeper aspects. And then Clark specifically worked a lot with people like Burnett, with Skinner, worked on the clinical aspects, even homeopaths like Grimmer. And finally, Master Farrington, also one of my favorite homeopathic writers. I'm so in love with Farrington because he was probably one of the first person who started understanding remedies as kingdoms in different kingdoms. He started writing groups as fungi group, spider group, reptile group, many years before. So when we talk about homeopathy today, and when we talk about going to the next level, when we talk about all the recent advances in homeopathy, it is at the basis and foundation of classical homeopathy. And this is classical homeopathy, the purest form. And from here, it's almost like a whole new spectrum, a whole new ideas coming through with the ideas of understanding of kingdom, miasm, sources, toxicology, core, genius. And we somewhere lie in between of understanding all these different aspects of classical and contemporary homeopathy together. It's so fascinating to be in today's time and today's age because we have the advantage of the newer concepts, of the newer ideas, of the newer themes, of the newer patterns, but we also have very strong basic foundation that our old masters has given. So I cannot think of any better time to be a really serious, finest homeopath that we can possibly be, isn't it? What do you feel? And we have quite a few number of people who have joined us on the Zoom and also on the YouTube also. The main thing that I want to also talk to you about is that if we really see, if we really see, the disease patterns are changing. The type of diseases which were there many years back is much different, especially due to the lifestyle, the food that we eat, the vaccinations, the generational patterns, the generational trauma. So the disease patterns are changing. And that's why the approach in today's time need to be much more multi-dimensional, much more multi-layered. These are the two very important words that I want you to keep in our mind, because more and more cases now that I'm seeing need kind of a multi-dimensional approach, kind of a multi-layered approach. The idea that one dose and it still happens, but quite the percentage of cases where just one dose and this kind of thing that happened, it would probably happen in less than 30% of cases. And I'm talking about really deep pathological cases. In most cases, in 70% of cases in today's times, the approach is very multidimensional with treating different layers and layers. So my idea today, and we have some time today, is basically talking about three different approaches that we use, the main approaches. The first, of course, the 153rd aphorism, the idea of individualization, the idea of holism, the idea of striking singular, uncommon, peculiar signs and symptoms, as 153rd aphorism speaks about finding deeper patterns, about finding that exact symptom, and so on. And a large number of cases may require this approach. And this is, I would say, about 75% of cases. You begin the case with this approach. In certain cases, though, this approach may not be totally useful. You might have to need an approach where there's a lot of roles of nosodes, sarcodes, bowel nosodes, tautopathy, isopathy, and I will talk a little bit about this. And finally, another approach, which sometimes we don't give too much of importance to, but it's very useful, is sometimes, in many cases, may require a very specific pathological simillimum, as Master Burnett or Dr. Boger would write it, a pathological simillimum, a remedy that matches the pathological complex. Even Tyler wrote about this. And in some cases, you might require all these three approaches together in one single case at different points. Are you all with me? Say a yes, so I know that you're all with me. Okay, quite a few people are awake, which is a good thing. So what I'm going to do now is we have roughly about an hour at least an hour, um, and I'm going to try to share with you about five or six cases. That is the idea. And through every case, we'll try to learn more about the approach. Of course, the cases, I'm going to summarize the case in short so that we can talk about the main thing in the case. That's the idea. Let's see. Okay, let's start with the first case. So, this is a very interesting case. It's a very interesting case of a non healing wound or osteosarcoma in a 53-year-old lady. So, this lady, a 53-year-old lady, had osteosarcoma, and after that, had a very deep infection, a lot of suppuration. You can see the wound was swollen, it was infected. I hope you can see this on the screen. And in this condition, the patient connected to us. In 2013, she had a soft tissue sarcoma. She had done some certain radiations, certain surgeries were done, and it improved. She got discharged, and again, after a few years, she got this recurrent infection again. And because of this recurrent infection, she started getting a lot of chills, fever, body ache. Yeah. She wasn't able to walk. The operated area, there was a lot of pain, a lot of soreness, a lot of suffering. The chills, especially more on the chest, then the heat all over the body, typically on the legs, a lot of nausea, the blood pressure going down, a lot of antibiotics given, but still not helping. At this moment, a lot of soreness in the leg, a lot of pain, a lot of bruised stitching type of pain, which is aggravated by standing, aggravated by sitting in one position, better by massaging, better by rubbing, a lot of slight transparent discharge coming out. So at this moment, they found out that what is the discharge, which is the main bacteria, and they found out it is Staphylococcus hominis. Yeah? And that area is very hot to touch. So at this point, they contacted us and we tried to take some history. She was a hot patient. There was a lot of craving for spicy food, eggs. There's a lot of sweat that she gets. This was the case in short. What to do? So with this, now in this case, you can try to individualize the case, but there is no very clear mind symptoms. There is no clear generalities. The whole focus is on the disease, on the pathology. In many such cases, the focus is to prescribe a nosol. And one of the biggest broad spectrum nosol we have in homeopathy, and we will discuss about it, is what I gave. And I gave Staphylococcinum 200 two times a day for 4 days. Yes, we gave Staphylococcinum 200 two times a day for 4 days. This is a remedy we gave. And beautifully, in with the help of Staphylococcinum, the wound healing improved, the pain reduced, the swelling reduced, the affected area improved. And even there was very good change mentally. And step by step, the situation with the wound and everything very, very beautifully improved. You can see at the end of 1 month, the infection and the abscess was beautifully improved. This is one approach. This is one approach where we found a remedy based on the pathology and based on the infective kind of background. Yeah? And Staphylococcinum, and we'll discuss about Staphylococcinum a little later. Let's talk about another case. I'm going to try to zoom the case a little bit. Let me see if I can zoom it for you. Okay, here we go. Let's see. So this is a man from another part of the world. Okay. And he contacted us because he had a non-healing ulcer after a road traffic injury and a big non-healing wound just below the knee. And if you see very closely the wound, you can see the open wound which is non-healing at all, with the infection, with the suppuration, and so on. And he has taken close to 40 homeopathic remedies without much change. Can you imagine? He has taken close to 40 homeopathic remedies without any change. And then he has come to see us. What to do? So we study the case. What to do is not a question. The question is to find the remedy for the person at different layer. That is why I constantly am talking about multi-dimensional and multi-layered approach. Today's advanced homeopathy is very different to what you studied during Kentian time, or what you spoke about during Boger's time, or about Bonninghausen's time. Actually, today's modern homeopathy is more closer to what Burnett did, what Master Burnett did with the idea of ladder of remedies. It's a multi-layered, multi-dimensional approach. So let's see this case. I spoke to you about this man, about 50, 60-year old with this very bad ulcer. And when I studied his case, and I remember this case because we did this case late at night at 10 p.m. and I started the consultation and I asked, because he stays in another part of the world. So I asked him, tell me about your problems. And then he started talking, okay, you want to know about my problems. My problems are so many, but they are not my problems. And he went talking and talking and talking and talking and talking for 2 hours. It was 12 o'clock at night. And the only thing that I understood in 2 hours of his constant talking, because throughout the next 2 hours, I didn't have to ask one word. He went on and on and on. Whoa! The only thing he kept speaking about is women, about different women, about sexuality, about different alcohol he drinks, about what kind of Casanova personality he is, about the alcohol that he drinks, about how many different women and friends he has, about how beautiful a person he is, how sexual a person he is, how much he loves to socialize, how much he likes to joke. Constantly, just for 2 hours. It was too much. I was like, my God, for 2 hours. By the end of 2 hours, I clearly knew that this is a person whose whose main thing is he just doesn't stop. He talks and talks and talks and talks and talks. And if I wouldn't have stopped him at 12 o'clock, you know, he would be talking throughout midnight because it was morning for him. This was the case. Of course, he spoke a lot about the case. But as you know, so much of talkativeness, so much of talkativeness and talkativeness and talkativeness and talkativeness. It was a clear cut case, which you already know now, of lachesis. Only a lachesist personality can talk so much. So the first rubric I took was wounds with slow healing, wounds suppurative, wounds granulation proud flesh, alcohol, lasciviousness, vivaciousness, because he spoke with a lot of animation and a lot of fervor, a lot of communicativeness. The fact that he doesn't believe in religion, godless feeling, the fact that the ulcers had a bluish margin. So this is what it was. It was for me a very, very, yes, you're right, a clear cut case for me at that point of lachesis. But there is only one problem, that I didn't give lachesis. I didn't give lachesis. Then what did I give? Think. You suggest me. What did I give? Yeah. Think about it. The fact remains, the fact remains that in this case, let me try to tell you, the patient has already taken close to 40 remedies. And out of them, five remedies were reptile remedies. And almost all of them were animal remedies. What to do? So, in many such cases, the main thing is there is a lack of reaction. There is a block in the case. There's a block in the case. What to do? How to open the block? What key should we use? Let's see, any thoughts? Yes, many such cases, I open the block, especially by a use of a nosol or a sarcode or a bowel nosol. The only very important thing is that I don't close my eyes and give any remedy. I try to find an indicated nosol, sarcode, or bowel nosol. Yeah. So in this case, what we did is I looked at this pathology again, and I saw this pathology. Yeah. And you can see here. What do you see is the main thing? What is the block? What is the block of these non-healing wound? You have to tell me what is the main block. What do you see as the main block of this case? So the main block, let's come back. So the main block of this case, and you can see this very clearly, is the suppuration, is the infection. So again, we are thinking about a broad spectrum nosal. And again, once again, the remedy of choice for me is Staphylococcinum 200. Two times a day for 3 days. This will open the block for me. Wait for 2 days for the layers to heal, followed by lachesis 200. And what happened with this? What happened with this? And you can see very slowly, steadily. I want to show you step by step. Gradually, the granulation tissue filled up the entire ulcer. And in less than 1 month, you can see the ulcer beautifully, very beautifully, just gradually healed. And you can see here, step by step, the entire healing of our patient with Staphylococcinum followed by lachesis. This is the multi-layered, multi-dimensional approach that I want to talk to you about. This is changing the approaches, changing the cases worldwide. And many homeopaths across the world are now using this approach of multi-layered and multi-dimensional approach in many of their cases which are blocked. And I want to share with you all these important approaches and how to go to the next level. Isn't it fascinating? And because all of you are asking, so I will just try to talk a little bit. A few of the colleagues asking how to know it's Staphylococcinum. So what I'm going to share with you now is a discussion about Staphylococcinum as a remedy at a deeper level. What is the main pattern of Staphylococcinum? How Staphylococcinum now is a full-fledged, broad spectrum remedy, like a constitutional remedy. How you can prescribe Staphylococcinum like tuberculinum, like calcarea carp, like sulfur. What are the indications? And that's what I'm going to share with you. So the main genius of Staphylococcinum is suppurative pathologies, feeling of being trapped. Let me talk a little bit more about this. Of course, the main indication of Staphylococcinum that we knew in our past generation of homeopathy, thanks to French homeopaths, is they are important remedy, especially in diseases where there is Staphylococcus bacteria is present, like boils, like impetigo, like infections, like osteomyelitis, like acne. In acne, many cases of acne, suppurative acne, very often the first remedy was Staphylococcinum. In many cases of diabetes, immunocompromised disease, where there is bacteria, first remedy was Staphylococcinum. This is something we knew. But what we now know, thanks to a lot of work by a lot of colleagues, and I'm going to share a few ideas from Riley's proving and also going to share some ideas from my colleague Bob Blair's writing, that now Staphylococcinum has a special affinity on skin, gastrointestinal tract, and head. They are generally very focused, excited, or over adrenalized. Yeah. They can be quite nervy, hyper, shaky, as from caffeine buzz. So they are very excited. They almost remind you of coffee. Their hands are often trembling. They could often have restlessly. They could wake frequently. So this is a little bit about the main patterns of Staphylococcinum. One of the commonest dreams of Staphylococcinum is often related to insects, very interestingly. Dreams of insects, dreams of cockroaches, and also dreams, very sexual dreams. These dreams of insects is very interesting for Staphylococcinum. There's a lot of feeling of helplessness and even a feeling of, I am a victim. Why me? Why this happened to me? Wrong suffered. And that's why it may look like snake remedies, like nausea, like lachesis. So very often, many complicated cases of ulcer, I have found out that I have given Staphylococcinum followed by lachesis. And it's no coincidence that both have the feeling of being victimized and suffered wrong. There's a lot of feeling of embitterness, a lot of feeling of why me, a feeling of lot of weeping, lot of frustration, lot of hopelessness regarding the future. a lot of tired feeling, a lot of confused feeling, a lot of disoriented feeling. I want to go to bed early. I want to sleep early. They're quickly falling asleep. Their memory can be an issue. Losing train of thoughts, forgets what he's talking about. They could have the worst headaches, sometimes left, sometimes right, pulsating headaches. And that's where it could remind you sometimes of a remedy like belladonna or a remedy like glonoine. In many gastrointestinal disturbances, like a lot of cramping, a lot of loose, uncontrollable diarrhea, early morning diarrhea, you're thinking about allosocotrinas, you're thinking about podophyllum. It could just be staphylococcinum. Ladies and gentlemen, we are talking about deeper patterns of Staphylococcinum, ladies and gentlemen. Very often, they may have a lot of skin boils, abscess, with or without itching. Staphylococcinum. What are the main physical sensations? Right? There may be a lot of heavy, sore feeling. Soreness seems to be an important kind of sensation for these patients. Soreness. Many of them may get chapped lips. Interesting craving is craving for peanut butter and especially spicy food. Many of these symptoms are aggravated before menses, and that's why you can think about remedies like folliculinum. In the folliculinum, we normally always look at symptoms aggravated before menses. Many lac caninum, lac defloratum, mammal remedies have indications of symptoms aggravated before menses. Staphylococcinum. Remember, Staphylococcinum will also have the energy of the bacteria in the human. So it could have a little bit of pattern of the bacteria with the pattern of the human energy. And that's why you could see a lot of symptoms sometimes in Staphylococcinum may look a little bit like the animal remedies. It's very interesting what we are talking about here. It's also very important to compare different remedies. Remedies like arsenic alb, sulfur, calcareous sulf, hepar sulf. All this we know because all of them have yellowish kind of tinge in that way. One of the main things that you will see in cases which require staphylococcinum, you will see is the feeling that reminds you a little bit of acid remedies. Is a feeling that reminds you a little bit of carcinosin patterns, where the idea is, you know, looking to do something, looking to do something special, looking to take advantage of instability, wanting to do something exciting, wanting to create a problem, then solve them, then too much overwhelming feeling, too much. It's too much. It's too much. Things are getting out of hand. It's too much. This is the feeling. It's too much. This could often be a very deep experience, a overwhelming feeling that could come in a lot of remedies which require Staphylococcinum. Are you all with me? Say yes. Hello. I hope I have not put you to sleep. In the last session, you will tell me the finale session and you're putting us to sleep, huh? Sometimes you also have to prescribe just a snapshot prescription. Sometimes quite snapshot prescription. So this is a case of infective chickenpox in a lady who felt very traumatized, in a lady who felt victimized, in a lady who felt why me, and you can see very bad phase of infective chickenpox all over the body. Yeah. And what did I do? Nothing. Staphylococcinum 200, 2 times a day for 2 days. Staphylococcinum 200, 2 times a day for 2 days. That's all. What happened? Staphylococcinum 200, 2 times a day. Very beautifully in the next 3 to 4 days, gradually the healing happened. You can see the change yourself. Yes, my friends, welcome to the world of Staphylococcinum. Never before thought about. Our knowledge of remedies and materia medica is broadening, and it is also broadening because the use of remedies across the world is also traveling, and it's also one of the reason I want to tell you why we are able to evolve more. And I thought about this, I was talking to someone, and I thought that why it's happening, why this energy pattern is happening, and I found out, and I found out is because of traveling, because of connecting, because of unification. I think this is a very important thing, In the last couple of years after the COVID and during COVID, we did a lot of cases with homeopathy. We helped across the world. We helped so many patients, and many homeopaths did. But during the COVID and after the COVID, I got an opportunity to travel a lot. I traveled. I was recently in Budapest, and before that in Moscow, and before that in London, Belgium, Brazil, France, Switzerland, Italy, and a few more countries. But this helped me by two things. The first thing is the cases. I got an opportunity to treat cases of my colleagues from different parts of the world and share ideas and learn from them. Now this helped me a lot because what I see more and more is the more cases you are able to do across the world, you are able to also understand different concepts, what potencies work where, what kind of repetitions are required more. For example, I have this is something very beautiful. In India, I find that patients require more frequent repetitions and more comparatively higher potencies. And probably in the West, they require lower repetitions and lower potency compared to the if the same patient I see here and there is very interesting. So interesting that I see this. And I also share this with my colleagues and many of my colleagues across in different parts of the world. They also share similar ideas. This is interesting. We need to come together with these ideas. So So the need for unification, need to discuss, need to come to a single platform and discuss all these ideas. I believe this is the need of the hour, and this particular idea brings me to what I'm here to talk about, and I'm going to talk more about the different nosodes, Staphylococcinum, Streptococcinum. But what I want to talk to you here, so important, so very, very important, is our new course. Our new course is starting. It's called as Rediscovering Repertory. Every master was once a repertory student. And this is a really, really special course. This is a course which is very, very, very close to my heart. Um, this is a course which is an online course. You can join it in the weekends. You can join live, or you can also kind of watch it the way you want, whenever you want. It will be probably on the weekends. It will be at night. It would be about 20 sessions and about 30 hours. And what we have tried to do is we have tried to put together the world's finest homeopaths together on one platform. We have invited homeopaths like Jeremy Sher, my teacher, Dr. Vijay Vaishnav, the reason I'm here, Dr. Vijay Vaishnav, couple of the closest allies that I have with Dr. Gajanan, Dr. Borkar. Of course, the very, very fascinating teacher of ours, Dr. Parinaz Humranwala, Dr. Ajit, Dr. Heiner Fry, who's going to talk about Bonninghausen with us, Dr. Praful Barwalia, one of the most senior most homeopath from ICR school, of course, homeopath like Dr. Mayuresh Mahajan and Dr. Dinde from HHF with the understanding of metaphorical mind approach. Of course, Luke, my dear friend from School of Homeopathy, will be with us. Dr. K. Srinivasan, also a very, very fascinating teacher from the South. And Dr. Vijay Krishna, who is going to be talking about Dr. Vijaykar's ideas of understanding repertory. So what you are seeing is we are going to talk about different repertories. How to use Nair repertory, how to use Clark repertory, how to use kind of a Kent repertory, complete repertory, Bonninghausen repertory, and finally, how to use all of these repertories together. This is the idea. We are going to start with very basic level, including the understanding the structure of it, philosophy of it, conversion of patient language to rubric, understanding depending on the case which repertory to choose, how to use all these repertories together, how to understand mind rubrics at a deeper level, how to understand delusion rubrics, how to understand exact rubrics. So this will be with a lot of clinical case studies. And plus, we are going to be making a WhatsApp group, which we already have made. By the way, we already have close to 70 registrations. So our registrations are full. Where every day on a WhatsApp group, one case is put up and you have to solve that case in the next 48 hours. And the best answers, of course, towards the end of it, get a very special gift. We are going to talk about how to treat cases with no symptoms, where you have to use Fatak repertory, Boric repertory. I mean, every really good homeopath has been a master of homeopath. You ask any good homeopath who's top class. And the main idea is all of us coming together. Of course, I will be taking the maximum lectures. I will be taking 60% of lectures because I want to keep a streamlined into understanding the repertory. All of you are watching right now on our lecture group, you're going to get a special discount. You're going to get a discount up to close to 25%. And this is available for the next 10 to 12 days till 30th April. And especially only for the first 200 participants. So we already have 70 participants who have paid. And the next 130 participants get a 25% discount. What to do? You have to email me, gaurangedgy@gmail.com. I want every single one of you who's here, who's watching this, who wants to go to the next level to be a part of this course. And the only reason to have this course is to burn our blood on the weekends, put so much of energy. I always promise 30 hours and I do 40 hours. This is what I do. I don't know why, but this is how it is with me. Because this is very important for us, for me, for my colleagues, because spreading the right kind of classical homeopathy in today's times and this multi-layered and multi-dimensional approach which we are going to talk about is very important in today's times when the world is talking about new theories. It's important to make such good foundations and such good level-headed thinking, and that's why I want to invite you. And I know that most of you will, but I still wanted to appeal to you to join this. I will wait today, and I hope that every single one of you joins this. Yeah. Let's come back to Staphylococcinum. Melody writes, I want to attend, but I won't have funds till the discount ends. Melody, write an email to me. Okay? Just write an email to me. Okay. So we spoke about Staphylococcinum. Let me talk a little bit because someone asked me how to differentiate Staphylococcinum, Streptococcinum, and other remedies. The closest remedy to Staphylococcinum is Streptococcinum. Streptococcinum, the main pattern is recurrent throat infections, recurrent boils, never well since infection, aggravation by sympathy, and lot of chills. Now, this is the main genius. Tyler writes the word, it's a mighty medicine, she writes in Tyler's Materia Medica. Boric writes, it has a rapid action, right? So it is said that Staphylococcinum is more of an acute state remedy, and Streptococcinum, come again. Streptococcinum is a more acute remedy, and Staphylococcinum is more of a chronic. What are the confirmations which I want to tell you about Streptococcinum? There's a relapsing throat infection. Always in Streptococcinum, there will be a history that the patient is getting recurrent throat infection. There will often be history of injuries in the past, and that's why many cases arnica may later on require Streptococcinum. Many post-surgery related pathologies require Streptococcinum. One of the commonest, and this is something I have to give the credit to my teacher, Dr. Sarkar. He often told me that if you see a case of throat infection followed by rheumatoid arthritis or arthritis, you start the case with Streptococcinum 200, 2 times a day for 2 days. And I've used this indication very times. It's very important in many cases to understand the origin, duration, progress, how the problems start, and so on. Most Streptococcinum generally very hot. Most Streptococcinum aggravated by eggs like Chinanum ars. Another remedy is psychotic compound, which is also bowel nausea. Low septic state with dysentery, and finally clean tongue. And I'll just add a couple of indications which I want to share from another of my teacher, Dr. Jayesh Shah. He did some very interesting work with Streptococcinum. And one of the biggest pattern he saw is that there is a lot of fear of disease. Yeah? There's a lot of fear of disease, which almost reminds you of remedies like arsenic, like causticum. Yeah, this is a very important part of Streptococcinum. There's a huge fear something will happen, something very big will happen. It's a very important concomitant indication. Streptococcinum could have this state of pessimism, of something strong will happen, and could be very sensitive, like pulsatilum. So these are very interesting kind of patterns of Streptococcinum. Hello, are you there? Say yes. Okay. The other very important remedy, which I want to call you, is more of a modern day silica and Hippozaninum. is I want to talk to you about Hippozanium. And this is a quite an interesting remedy. In many cases, when all remedies fail, in very complicated cases of infection, suppuration, pus, think about a very, very interesting remedy. Hippozanium, ladies and gentlemen. Hippozanium. Hippozanium, interestingly, is known as the disease of glanders. Very interesting. The main thing about Hippozanium is that very often they could have infections in the lung. That's why when you think about remedies like antimony tartaratum, when you think about remedies like silica, when you think about remedies like all of these stannum metallicum, think about Hippozanium as an intercurrent remedy. And especially the lymph gland is affected, especially the nose is affected, especially the throat is affected, especially the skin is affected. It's a huge, huge, huge remedy for the nose. You can see here. Discharges from the nose, one-sided, albuminous, tough, vicious discharges. So many chronic cases where you're giving Cali bichromicum, if you study them well, they may turn out to be hyposemium. So interesting, no? Isn't it so interesting to be a homeopath? There are there are so many possibilities. The world is full of possibilities. The world is full of abundance. Aren't we very lucky to be homeopaths? My God, I feel that every moment. We are just so lucky. We are destined. Yeah, we are. So, yeah, even in many cases of complicated cases of cancers, cancer of the breast, most cases after chemo, after radiation, where there is a lot of infection and there is fibrosis. Think about Hippozanium. It's such an important remedy. My God. One life is not enough. Huh? Another case. Another case. So we spoke about Staphylococcinum, we spoke about Streptococcinum. Let me talk to you about another case. This is the case of alopecia, hair issues, hair fall related issues. This is so common, huh? Alopecia areata, alopecia universalis, and so on. So this particular women, 28-year-old women, came to meet us with alopecia areata. And you can see her hair fall and hair spot and was in a very bad condition. And of course, I took her case and I studied her case. And when I studied her case, the case came out to be a very, very kind of beautiful, beautiful case of phosphorus. She was a very sociable person, very communicative, very loquacious, a kind of person who could connect to anyone, a kind of person who was very sympathetic, very compassionate, very friendly, who had a lot of fears of being alone, of thunderstorms. and who loved company, wanted to be with company, what a lot of desire for cold drinks, ice cream, cold food. It was a classic case of phosphorus. The only problem that phosphorus didn't help her for close to 3 to 4 months. I gave different potency, but no change. What to do? No change at all. What to do? What to do? So, what I did, of course, this is what we do in cases where there is no change. There is only one way, that is, we restudy. And I want to tell you that many cases, we have to restudy cases. It's not always that you give a remedy and next day the patient is better. And I can tell you that about all the homeopaths across the world. Everyone has failures. The only difference is that when they see a failure, they want to restudy, they want to work again. They have this spirit of not giving up. And I think that is a very important mindset as a homeopath that I want you to kind of develop, where the idea is that the remedy choice failed, the analysis failed, homeopathy didn't fail, and the homeopath didn't fail. The more you're able to detach yourself from the issue and put it as an issue based solving that is needed, the more you will not get affected too much by it. And this is something that that we have to develop. And this is again, I'm telling you, I've developed this mindset after training with really good homeopaths, and that's why I want to be associated with training some of very good young homeopaths and even older homeopaths here. And I can tell you this more because I've failed more often. The more often you fail, the more easier it is for you to it is for you to work on cases, huh? And we also have to learn to take failures on our chest. We have to take failures on our chin. That yes, let's do it again, plain gentlemen. So what was the situation? So at this point I asked her, what is it? Tell me something about your case. And then she said, Doctor, there is two things that is very strange in my case. I said, tell me. She said, one is my hair is very brittle and they tend to get kind of stuck onto each other. I said, okay. And then she says, Doctor, sometimes the hairs which are coming, the new hair which are coming, they are white color. Why am I getting white color hair? She says, very interesting. So, okay, we categorize her. She's phosphorus, she's calcarea, she's natromute. But the idea is now to find more exact symptoms. And this is where there is a whole use of different repertories. Of course, one of them is Fatak. And the very beautiful rubric of Fatak. You all know this. Fatak, hair affections falling, gray hair replaced by, and the remedy, of course, is the beautiful remedy, which you already know is Vinca minor. Yes, Vinca minor, ladies and gentlemen. Written by Clark, written by Borick, and belongs to the Apocynaceae family, interestingly. No? Lesser periwinkle. And that's what we give Vinca minor 30C 2 times a day for 7 days. Many of these lesser known remedies, which are not clinically proved so much, you need to repeat these remedies more often. And beautifully, with the help of Vinca, you can see her hair improve. So beautiful to see improvement, isn't it, in a person? And a hair is such an important part of women's health, especially because it is directly affected by the psychology. And she did very well with Vinca. Let's come to another case. We are doing a lot of cases today, ladies and gentlemen. We saw this improvement in less than 45 days. Let's come to another case. So this is a very interesting case. It's a case of a 27-year-old man. And again, his problem was hair fall. And you can see the alopecia, the hair fall, the hair thinning. And he had hair fall, patchy hair all over, on the chest, on the eyebrows, on the breast, on the kind of armpits, everywhere. And he has taken a lot of homeopathic medicines. And now he feels that he will never get better. There is a lot of despair. He says, Doctor, I'm coming to meet you, but I don't think I'm ever going to get better. I feel very negative. I feel I will not get better. I feel totally pessimistic, very discouraged, and so on. This is where we try to understand the case history. There was a history of a lot of frequent coryza for which he took a lot of steroids in the past. And there's a lot of desire for spicy food. He sweats a lot generally when he eats warm food. His sleep is quite infrequent. There are a lot of fear of animals for our patient, and fear of darkness. He wants to be with people. One of the kind of dreams he says is that someone held his chest and he's trying to scream, but he's not able to scream. He wants to just hold on to something and scream and scream and scream, but he's not able to do that. And he's very scared about ghosts because he lived in a village, and that was what it was. A lot of anger if someone lies to him, that can affect him a lot. He doesn't want to talk to that person. He wants to go away from that person. He doesn't want to fight back. He wants to go in a kind of a shell. He keeps it inside him. He says, if I lie or fight back, what is the difference between me and him? So there's a lot of you versus me versus him. He's very emotional, especially about his family and about suffering of others for him. And he likes to walk. He likes to go out. He also has some sexual issues. And his main feeling in the whole case was he was very, very frustrated with so many medicines, so many treatments that he has given. He feels now, what's the use? I'm never going to get better. What to do? What remedy should we give? Think. Socho. Anisha writes it could be an animal remedy. Okay. Ruxana writes selenium, carcinosin. Sorry, Somnath writes selenium. Ruxana writes carcinosin. Medorinum. Okay. Ophidia. Okay. Syphilinum. Okay. Animal, mollusk. Okay. Stramonium, cocculus. So a lot of suggestions from our colleagues. This is how we study. This is how we are going to study all different repertories. We are going to solve close to so many 50 cases, go step by step into understanding repertory. This is how we are going to do it. This is how we have already done. Streptococcinum, roostox. Okay. So what to do? I'll tell you. So what I try to do, I'll tell you. What I try to do is that I just scan the whole case. And why I'm able to do that, that also I'll tell you, is because, my life has been just with different homeopathy and homeopaths. And that's why what I did is I learned different techniques of homeopathy from very different homeopaths. And that's why for the same kind of case, you can think in 4 or 5 different kind of directions. And that's why I talk about multi-dimensional homeopathy. Don't think in one direction, think in more than one direction. And what you have to do is, when you scan the whole case, you have to see what is the most important area of the case. And if you study his whole case, of course, he's taking treatment for so many years. He's going to be frustrated. He's going to be despair. Yeah. He doesn't like people who lie. All this is common. If you prescribe on that, natramur, sorinum, nothing is going to happen. So what I do is I scan the whole case, every different areas, mind, general, physical, general, past history, family history, dreams, fears. And when I look at the whole scanning, I find something very peculiar, that he sweats a lot, especially when he eats, and especially when he eats something hot. Now, this is something which is very intense for him. Now, this also connects. You can't prescribe on one symptom. This also connects to a very important mind symptom in his case, where he says that he tends to keep everything inside him and he tends to shut himself. There is only one remedy in perspiration: eating something warm. How do I know it? Kent Repertory. Kent Repertory may seem this is very easy, but remember, till 15, 20 years back, 90% of homeopathy was based on Kent Repertory. And that's why finding the exact symptom in repertory is what I want you to master. And when you open Kent Repertory, ladies and gentlemen, and when you open the rubric, sweating on the face, yeah, which was sweating on the face while eating warm food, there is only one remedy, plain Jane. It's a remedy which is a woman's remedy, but remember, CPI is a very important men's remedy also. Yeah. Read about it from Kent. Today, go and read Kent and see how beautifully CPI is for men's health. We have to think out of box, ladies and gentlemen. So perspiration, eating warm food, of course, all the fears, the despair, the hair fall, and also this wanting to shut. This very important state of this is a very, very important state of the C remedies, wanting to shut, and him wanting to go out and travel and want to walk and want to exercise. This is a very important part of C remedies. So again, this is something we are going to learn how to understand kingdoms, miasms, patterns, families through understanding of newer concept of repertory materia medica with newer ideas. So these are the concept of C remedies. What are the main patterns of C remedies? Many of these C remedies have action on endocrine area, on hormonal disorders, on PCOD, on thyroid. They are people who are very naive, not very evolved, and they could be often quite impulsive. They could be quite having a lot of allergic and autoimmune pathology. They could be very, 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 very sensitive to music. Could be remedies belonging to C family. Many of these patients feel better when they are near the sea or a water body, and they are always better by movement and exercise. But what did I give him? In many such cases of very, very deep kind of hair issues, I generally like to start with 200, followed by LM1 for a few days, maybe 3 days, and then I follow. And very beautifully, you could see with the help of um, CPI, you could see start seeing some very beautiful changes in him. His hair improved, his overall health improved, and his despair improved. In fact, I once went to a cafe and I was drinking coffee and he just said, "Sir, did you recognize me?" And I didn't recognize him. And he was the man. He was our patient. So interesting, no? Isn't it? But in hair related issues, and because this is also a course for dermatology, I also want to share with you one of the maps that we have created here. We have to sometimes think out of box. Many of thinning of hair, um, one of the remedies I often use is thallium metallicum. You know, very often after climaxes, the acid remedies become very important, including acid phosphorus, fluoric acid. In many cases, you have to study the deeper miasmatic patterns. And in many of the cases, you want to think about sarcodes. And there are many sarcodes for the hair. One of the very important sarcode for hair related pathology is thyroidinum. In some early male pattern balding, even in women, you can use the remedy prepared from the testes 30, pituitary anterior. So there are so many different approaches. Are you able to recognize this multi-layered and multi-dimensional approach and thinking about a case in different ways? हेलो, कहाँ हो भाई? Yeah. So many different approaches. And maybe at this point, I will open up the situation for question and answer. So what I would like you to do is write your questions on the Q&A, and I will try to answer on the Q&A. It's there is a section here Q&A, and you can just write the question down here because I missed answering some of your questions. I'm going to take the first question here. When we see many cases, they have taken many antibiotics. What to do? Sunanya asks, in cases where definitely when they have taken many antibiotics, um, you have to give the indicated remedy. Many such cases, you can definitely think about first about certain tautopathic remedies that can remove the layer of antibiotics. You know, many nosodes are useful in such cases. Maya writes CPR single dose. No, it was given for 2 days, and then LM. Falak writes, how often can we repeat CPR? As in Boric, it's mentioned it's not to be repeated very often. Falak, this is again Boric's experience, and we have to take it at the idea of Boric. But many different homeopaths across last few um, kind of generations have had different experience. So my idea is that you could repeat it actually every month if needed. Bhagyashri. In first case, you started with nosode. Can we start with nosode? Yes, a nosode can often open the case. These days, ringworm may not be responding to medication. Any suggestions? Yes, Ravindra. Um, Give a deeper indicated remedy. Yeah. And in many such cases, you might have to give intercurrent nosodes, anti-miasmatic remedies. Even think about ringworm in 30 potency. Um, any nosode sarcode to break tendency to catch recurrent cold, Ruxana. Find the remedy for the patient, individualize. Colina writes, can you elaborate on prescribing multi-dimensionaling? What is layered thinking? Colina, that's what we discussed a little bit today. Maybe I will try to find a way by which I could make a little short video talking about what is multi-dimensional, what is multi-layered approach, maybe sharing more cases. But the idea is to think in different directions in the same case, and the fact that the patient may require different layers of remedies at different points and not get stuck to a remedy or a dose. This is the long and short of it. Shazia writes, when the patient is used to steroidal local application for acne and other skin condition, very dependent on it, come for homeopathy, how can we help them? In many such cases, think about also using kind of the nosode, the sarcode. That is, you could actually use many patients who are taking steroid. I often give cortisone 30. Someone who's taking prednisolone, I'm given prednisolone 30. Yeah. So you can think about this thing. Think about, don't get stuck, but think about it as broadening your vision. No? Alexander writes, importance of dandruff. Dandruff, you have to prescribe deeper remedy. Many homeopaths claim Staphylococcinum and Ledum, and there is a remedy in boric called as Cochlearia aromariaceae. But I've given it and it generally doesn't help. You have to give a deeper homeopathic remedy. There are many, many questions, you know. I don't know if I could answer all of them. I really don't know. Shazia Khan writes, lesser known remedies like pediculus. Yes, I have made a video on pediculus on my YouTube channel, Homeopathic Hub. Do have a look. It's a well indicated remedy, well proved remedy. You could use it. Lichen planus on oral cavity medicine. You will have to find a remedy for the person. There is no shortcut, huh? There is no shortcut. Which cases we can use LM? Especially in cases where you want to repeat more often, you want to use the LM potency. Um, can Staphylococcus be used in anal fistula? Very often you can use it, especially when there is a bacterial suppurative kind of layer to it. Very often, yes. Um, so many. When do you use bowel nosode? My friend, I've written an entire book on bowel nosodes, and there are 7 bowel nosodes that we use very often: the Morgan Pure, the Morgan Gartner, the Bacillus number 7, dysentery compound, psychotic compound, and I cannot at this point imagine to sit in the clinic and see patients without having the knowledge of bowel nosode. They're so important in today's times, and I hope that you can go to my YouTube channel and type bowel nosode and watch my videos about bowel nosode. I hope you can do that at some point. Yeah. And a lot of people are joining here again. Once again, I want to invite you to this entire new course about multi-layered and multi-dimensional approach of using repertory, kingdom, miasm, nosode, sarcode all together step by step from basic to advanced. This course starts in June. The fees for the course is less than the money you would spend on a dinner or the money you would spend on a dress. The knowledge that you will gain with homeopaths, starting from my teacher, Dr. Vijay Vaishnav, to Dr. Nikam, who has a hospital in Pune, almost a 200-bedded hospital, to Boninghouse and Heiner Fry, to Dr. Mayuresh from HHF, to Praful Barwalia, who has done an entire research on autism. He has a Spandan organization, to Jeremy Sher, to Dr. Gajanan and Borkar, to myself. This so many, 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 Dr. Vijaykar's, Dr. Vijay Krishna, and so many different topics with a very, very special discount, which all of you get for the next few hours. I can really not say anything else other than the fact that I really want to make sure I see every single one of you in this new course that starts in June, but the early bird discount finishes in the next few hours. It would only be there for the first 200 participants, and we already are coming close to the first 70 participants. Write an email, gaurangg@gmail.com, and you will get all the details of the course, the fees, the logistics, and the advantages. You can watch it, the course, the way you want. The access will be given to you for 2 years, so you can watch it, on some day, on a holiday, in Christmas, whenever you want. But this particular discounted fees will be available for the next few days. So this also brings to an end a very special course on dermatology, and all of you were there with us, and I do believe this made a difference in your life. I do believe that it should have helped you. And some questions, if I'm not able to answer, please write to me and I will try to answer. And I want to thank Dr. Shrishti. She's not here, but she's our main person for handling this course. Dr. Moksada, Dr. Utsav is here. He is also here today. And everyone, Dr. Jaya, Dr. Mega, who's handling the entire cases. There is a whole WhatsApp group where every day the cases are solved, repertorization techniques are put up. And so many of you are getting prizes for that. So many of you are getting the right answers. And everyone, Dr. Shivani, and even the translators, the Brazilian translators, everyone. So I look forward to see you once again. I look forward in the next few minutes to receive emails from every single one of you. Thank you. Namaste. Obrigado. Das vidania. This is a very beautiful word in Russian. Das vidania. Till we meet when we meet the next time. Thank you and das vidania.